The outcomes of childlessness show significant variations, especially among men and women. Some sources suggest that childless men report being unhappier than childless women. Women report being more satisfied with their voluntary childlessness compared to men, with higher levels of gender equality being associated with larger effects. Women being happier and more content with childlessness is associated with the fact that they carry the greater burdens of pregnancy and parenting, with childlessness resulting in more meaningful returns for women than men. The sense of personal choice and control, as well as stigma rejection among women, serve a great deal of importance in protection against negative mental health outcomes. Stigma rejection is achieved by introducing a positive spin to the assumed non-normative position. Men's approach to autonomy and independence limits their willingness to discuss childlessness decisions with their peers. Most childless women have had at least one conversation in their relationship or with their peers concerning childlessness. Men's lack of communication, including in relationships, often raises the likelihood of terminating a relationship once childlessness intentions are stated. For both men and women, the decision to remain childless takes place over time, evidenced by the belief that the decision should not be half-hearted. Part of the decision to remain childless for men and women is the willingness to take on societal pressures, deflecting that pressure and, seemingly, charting new paths outside the perceived sacrifices of parenthood. Despite claiming not feeling pressured by friends and family, some men express guilt for not respecting their parents' wishes, with the pressure being alleviated by siblings who already have children. Most men at the normative age of entering fatherhood still experience difficulties processing the decision. The role of procreator is central to men's historical and evolutionary predispositions, but it is not the only one, as rebellion and risk-taking behaviors are also associated with masculinity. Just like women, men who decide to be childless often condemn the condemners, some of the most common talking points including claims that those who have children do so to have someone who will take care of them in their old age, effectively turning tables on parents' ethical choices as opposed to reflecting on the childlessness position as being transgressive and non-normative in most societies today. Resistance against the normative discourse as an identity leads to a deficit in self-awareness by focusing on the what they're not as opposed to what they are. Childless men seek to redefine their roles in society by contributing through other means such as philanthropy, actively participating in social roles, and participating in the lives of other children. Being a responsible member of society, or at least being portrayed as that, offsets the negative outcomes associated with the stigma of remaining childless. Some sources suggest that generativity development serves greater psychological well-being compared to parenting. For both men and women who pick childlessness, it appears to be increasingly important to shape masculine and feminine roles outside parenting as the dominant framework for both genders. The need to counter the normative presentation of the gender roles could be resulting from the moral criticism associated with childlessness.